So my name is Dr. Anthony Galante. Thank you for joining me this evening. I'm really excited to share with you some information, but what you're going to notice first and foremost is that I am not a professional speaker. I'm not a public speaker. So if I trip over my words, if I look at my notes too often, I apologize in advance, so bear with me. I'm putting my fears aside for this because I think this information is so important that I want to get it out to you guys and your loved ones to help you guys and help prevent any injuries. So last year when COVID hit, millions of us went home, and we went home in a hurry, and we went home to these makeshift workspaces. So people were working on futons, on the kitchen island. They're working on bean bags. Some houses had mom and dad in one room, kids in the other on e-learning, and whoever got the short end of the stick was in the basement. So we've been working on all different types of makeshift workstations. So what we're going to talk about is posture, how your posture relates to your function, and how your posture relates to your ergonomics, and how eventually your performance and your function is directly tied to your posture and your structure. So a year or so ago, we thought this was a temporary event. We thought, oh, a few weeks, we'll go home. A few months, we'll be back to the office, no problem. Well, now for many of us, this is the way life is. This is the new normal, if there is such a thing nowadays as normal anymore. So some people like working at home. Some people, for a variety of reasons, want to get out of the house and want to go to the office. Some people like a mix of both. Wherever you stand on that, I totally get it, and that's fine. What I want to do is make your workplace safer and healthier. And as you're going to see, we're going to be talking about prevention a lot through this talk. So the first thing I want to do is identify some of the problems that we've been dealing with. Why wouldn't that work? So New England Journal of Medicine, more people sit behind a desk now than ever before, on average 6 hours per day. I think that 6 hours is very, very low. That doesn't include your commute time if you're still driving into the office. That doesn't include eating dinner. Doesn't include it in the evenings when you're sitting in your chair. So I think that number is much, much higher. And especially this time of year, if you're an accountant, that number is much, much higher. So this increased sitting, it's really taken a toll, not only on us, but also on our children, right? I mean, everyone's been in e-learning for how long, no matter what age group. We've taken these kids and put them in home, and it's really taken a toll on our kids. I'm seeing more and more musculoskeletal problems in kids, and we're seeing more and more mental illness with anxiety and depression. Now, musculoskeletal injuries account for 1/3 of all work injuries and illness cases. Now, when you have these types of injuries, that means you either can't or it's very difficult to work. So basically what we want to do with this presentation is we want to protect your paycheck. We want to protect your free time. Because often how these injuries show up is on the weekends, when you want to do the hobbies you love and you want to be with the people you love, and you just can't, or you can't do it all the way because of these injuries. So as we get started here, have a pen and paper ready, or have your phone ready, because we're going to go over some really important statistics, probably some stuff you haven't heard before. But more importantly, we're going to go over the solutions to these problems. We're going to give you some immediate, usable, and consumable information that you can use today, right when we get off this call, to help start preventing injuries immediately. And on that note, the third bullet point there, musculoskeletal disorders are the most prevalent, costly, and preventable workplace injuries in the United States. Neck pain, back pain, carpal tunnel, low back pain, sciatica, all these conditions, they can lead to addiction of opioids, they can lead to surgeries, and a lot are preventable. So let's look at a few of the numbers. Now, the first rule of thumb for remote workers when you're working from home is to have a dedicated workspace. When we went home in a hurry, people are working on all different types of surfaces, all different types of furniture, but get yourself a dedicated workspace where you can apply some of the rules we're going to talk about in a minute. 71% of remote workers say their chair has caused them back pain. And that's because just what we talked about. People are using chairs that weren't designed for long-term use. Futons, beach chairs, folding chairs. I mean, you name it. I've heard it all this past year. 41% of people have neck pain due to their workspace. That means they didn't have neck pain, and then they went home, went into their makeshift workspace, and they develop neck pain. I think that number is only going to rise and increase as we go along. 74% say their keyboarders cause them wrist strain or injury. Now, this is likely due to their workspace setup and again, can be prevented. And you think about it, if three out of four people are having problems with their wrist because at their workspace, something's wrong. If that many people are having problems, something's wrong with their setup, something's wrong with their ergonomics. And we're going to get into that in a minute. And the big one here, 86% of at-home workers have experienced strain or soreness due to their office equipment or furniture. And again, those are the bar stools, the beach chairs, the desk you've been using that your kids used in middle school, and you're trying to work on it. This furniture wasn't designed for long-term use. As a matter of fact, our bodies were not designed for long-term sitting. We come from hunters and gatherers. Our ancestors, they never sat in the traditional way that we sat. So it's almost like movement is the answer, and movement is the answer. And as a colleague I know likes to say, motion is the lotion, so to speak. So I want to point out something that maybe you weren't aware of. When you're in a static position, when you're sitting still all day, that stimulates that sympathetic fight or flight part of our nervous system. It tells the brain you're in like a sympathetic dominance mode or a stressed out mode. And when you're relaxed, that's the rest and digest. And that has less stress, less amounts of stress hormones, such as cortisol, being released when you're in that type of state. Now, our bodies were designed for quick stressors, just like back in the caveman days. Our bodies were not designed for long-term periods of stress. So when we're sitting and you're in this flexed posture and you have this forward head and the shoulders are forward, you're turning on all these muscles, these flexor muscles, the pecs, the shoulders, the biceps to a degree. And you're telling the brain, hey, I'm stressed out. To relax it, we want to contract the extensor muscles. We want to get the shoulder blades back. We want to get that head back over the shoulders as much as we can. And that's going to stimulate more of the parasympathetic, the rest and digest part of our nervous system. Now, when you're in this sitting posture all day long and your brain's feeling like you're in stress, that can create a lot of negative health effects. Now, we've all been under stress and we all kind of experience it differently, but there's this kind of a group of symptoms that we all experience. And I want to read you a few from WebMD and tell me if you've ever had any of these when you've been under stress. Has anyone ever experienced anxiety and depression when you're under stress? Right? We all have. Headaches, memory and concentration problems, problems with digestion, problems sleeping, weight gain and fat storage is all due to stress. So when you're sitting and you're in this bad posture, we're doing a lot more to our bodies than we realize. Not only that, respiration is not as good. Cardiovascular function is not as good. So we're going to get into some specifics now. So have your pen and paper, your phone handy. We're going to go over some specific rules about your workspace. So this is what we call the rule of 90s. So if you look at the picture here on the right, if you have your hips and your elbows at 90 degrees with your monitor at or just below eye level, you're going to be in pretty good shape from there. You can see there's a little footrest here for this patient's feet. If her knees were at 90 degrees and they were directly under her, flat on the floor, that would be fine too. What you don't want is your feet back under the chair. That's going to cause your trunk to go forward. And if your feet go way out in front of you, your hips are going to come forward, your mid-back is going to touch the floor, and your head's going to be, touch the chair, and your head's going to be forward. We see that a lot in people with chronic back pain. They sit that way because it kind of stretches the back a bit, but obviously not a good posture. If I could make one change in your workstation, if I would go home and look at your workstations, I would bet it would be right here. I would bet it would be the monitor. The monitor, I want to see like right at eye level. You don't want it up. You don't want it down. And I have people tell me all the time they have to turn their head while they're on the computer all day. You want that monitor right in front of you, right at eye level, maybe just slightly below so your head is slightly forward. We know when you bend your head forward, the exponential stress builds up on that neck and that upper back area. So we want to be in as good of a posture as possible. Now, I'm also realistic. I understand we're not going to sit in a perfect posture all day long, especially when you're sitting for hours on end. But the idea is we want to sit in a better posture for more time of the day than we do in a bad posture. Now, if you look at those patient's wrists, you can see the forearms are the elbows are at 90 degrees and the forearms are straight. So What you can do too to help prevent any wrist injuries is get one of those pads that go right here in front of your keyboard, and you can set your forearms on that. And the whole idea behind that is you want to keep your wrist straight. The carpal tunnel is right here. So when you bend your wrist, you're closing down the carpal tunnel. If your wrist is straight or even slightly back a bit, you're opening up that carpal tunnel. But if it's way back or down, that's going to close down the carpal tunnel, close down that nerve, make you more prone to injury. So whether you're on the keyboard or the mouse, you want your elbow at 90 degrees, forearm resting on the desk, and your wrist in a neutral position. Another rule we want to go over is the 28-2 rule. 20 minutes of sitting, 8 minutes of standing, 2 minutes of movement. Now, of all the positions here, we know sitting is the worst, right? We've all heard the phrase sitting is the new smoking. If you look in the middle there, standing is better. And if you have access to a standing desk, or you have a desk where a flick of a lever, you can go from a sitting to standing position, even better. And the best part is moving. Now, I know it's very difficult to be moving and working at the same time. I was telling a patient today about a doctor who he's pretty fanatical about moving. He put his workstation on a treadmill, and he walks all day long while he works. And he walks very, very slowly, but he takes like 40,000 steps a day. He knows how bad sitting is for you. So obviously we're not all going to go to that extreme, but if you can follow this rule, that's going to be much better off than long periods of sitting at one time. So I'm going to go to the next slide. I'm going to show you some apps that can help you with implementing these rules. So this is Pocket Yoga. Now I apologize in advance. Most of the apps I like to give out are free. I believe Pocket Yoga just put like a $2 or a $3 fee on it. So if that's the case, I apologize for that. But Pocket Yoga is going to take you through a few different movement patterns, and they have them 2-minute sessions. You can take these little micro breaks. You're going to move your body in different positions, as you can see there. That's not something you're going to do on your own. To move your joints through different ranges of motion and take that micro break to get the blood flowing and move 2 minutes out of every 30. Now, the app on the bottom is called Stand Up. What Stand Up is going to do is remind you, because I hear every day, I say, Doc, I want to get up, but I get involved in my work, and next thing I know, I'm on a call, and then 3 or 4 hours went by. I get it. I totally get it. So the Stand Up timer will help, because you can set that to any time. You can set it for 20 minutes, and then you'll know to stand up. You can set it for 8 more minutes, and then you know it's time to do your movement. It's time to do your exercise. So you can get these apps, and they can help you implement these rules to prevent those prolonged periods of sitting. So with some more solutions, I put together a group of stretches on my YouTube channel and the reason I picked these is because you can do these right in your chair. So I'm going to encourage you to get up, and I want you to stand up, but I get it if you're busy and you're working. These you can do without even getting up. You can do it right now. You can do them right now as you sit here. So I'm not going to go over these in detail because they're on the YouTube channel. You can follow the video, follow along. Very simple to perform. And again, you can do them right in your chair. Perfect exercises for the 2-minute micro breaks that you're going to be taking every 30 minutes. Okay, so I want to give you something called the Dirty Dozen. So these are chairs and furniture that you don't want to be on for long periods of time. And some of these might sound silly. These are the stories I've been hearing for the past year. Believe me, people are out there in all kinds of weird positions with all kinds of furniture, trying to get their work done or trying to do schoolwork. So bar stool. A bar stool, typically your feet are going to be underneath you, which is going to force your head and your trunk forward, which we don't want. We want that head back over the shoulders. This one, the bed, I've heard this for years. People love to read in bed. And what they do is they sit in bed, they prop up pillows behind them, and then the books or your laptop's in your lap, and then the head's forward. And boy, you're just asking for problems with that. I think we can all agree a beanbag is not going to allow you to implement the 90-90 rule very well. Now, a dining room chair might sound like a good idea, but if you look at them, they're very square, 90 degrees, very rigid, and doesn't have much give or flexibility to it. And when the back is that rigid, you tend to lean forward more. So careful with the dining room chairs. Couch, certainly for work, because the laptop's going to be in your lap. You're going to be looking down, not something you want to do for a long period of time. Folding chairs obviously don't offer a whole lot of support. I don't know if I don't know about you guys, but working on the floor, I stopped doing that a long time ago. But if you got to find a position on the floor that's comfortable for you, I certainly wouldn't do that for long periods of time. The futon, you typically have your knees are above your hips. And again, the laptop's going to be down in your lap, head's going to be down. Lazy boy recliner, similar to the bed, you're going to be almost 90 at the hip, depending on how the back is, but your head's going to be down with the computer laptop in your lap. Beach chairs, camping chairs, obviously not for long-term use for work. Now, that brings us to the question, so what is the best chair? And my answer to that is the best chair is the one you don't sit in for prolonged periods of time. And it sounds like a cop-out, and it kind of is, but I don't really have a chair one recommendation for you. But the office chairs that are padded on the bottom and on the back support, the kind you can adjust the height, you can adjust the backrest, are probably going to be the best. And with those chairs, you're going to be able to implement the 90-90 rule better because you can adjust the height of the chair to your workstation. So you might not have heard of this. It's called the Ischialtuberosity. The Ischialtuberosity is otherwise known as your sit bones. Those are bones on the bottom of your pelvis, and you can kind of feel them when you're sitting, and they're attached to the pelvis. And if you have foot misalignment, if you have pronation, if you have leg length inequality, that can affect your pelvis, and that can affect the level of your pelvis as well as the level of those ischialtuberosities. Now, what we do for people is we give orthotics and we give other things to help to level that pelvis while people are standing and walking. And if your pelvis is unlevel, that could affect you when you're sitting. We know when you sit, everyone thinks of your neck and upper back being affected when you sit. Sitting increases the pressure exponentially on the lower back discs of your spine. So if you're sitting, we're increasing the pressure on your discs. If your pelvis is unlevel and you're sitting awkwardly, that's going to exponentially increase the amount of pressure on the lower discs in your spine, which can lead to disc herniations. If you talk to anyone who's herniated a disc, ask them how they like sitting. They don't like sitting very much. It's very uncomfortable. Now, if you have that condition and you go see your medical doctor, they're going to give you medication, anti-inflammatories, and muscle relaxants. You're going to see your orthopedic surgeon, they're going to likely do surgery to remove the part of the disc that's causing the problem. And physical therapists will do movement patterns and exercises to help try to strengthen the area. So we want to make sure we're finding that root cause of the problem. So if you are having some pelvic unleveling, we might have to adjust your workstation. We might have to adjust the way you sit after we examine you. So I want to give you a little warning here. And when we sit, after we sit for a period of time, we're all going to have some achiness, some stiffness, fatigue, muscle tension, muscle tightness. We expect this is very common. Now, common doesn't mean normal. When you're having these symptoms, this is your body's way of telling you, hey, there's a deeper problem. There's a biomechanical problem there that we need to address and that we need to fix. Also, what we tend to do with these problems is we grab the Advil or the Aleve. And the problem with that is you need more and more Advil, more and more Aleve to get the same benefit until you're like one of my patients that was taking 18 Advil a day. And that can lead to stronger and more medication if it's not treated properly. So if you're having any of these symptoms, I want you to make sure you look at your workstation and put together a good workstation and follow the 90-90 rule. Start implementing the 28-2 rule. We have those apps for you. I want you to download those and help you implement those rules. Go to the YouTube channel, do the stretches. If you do all those things and things are getting better, wonderful. And I hope they are, because we don't want you to develop these severe symptoms. So we all know the difference between low back tension and low back pain, right? Especially when it starts getting sharp. And when that pain starts radiating into the hip and going down into the leg, that's a commonly known as sciatica. The fancy name for it is a radiculopathy. That's a serious problem. You need to see a doctor. You need to get that addressed. When your neck tension becomes neck pain and it's painful, hard to turn the head, hard to look down, you need to see a doctor for that. The neck fatigue, people always tell me my head feels heavy. They sit on their desk and they kind of prop up their head on their hand because the head feels so heavy. It feels like weighs 100 pounds. Something you need to see a doctor for. If that neck pain starts radiating into the shoulder and goes down the arm into the hands and fingers, and if it's pain and tingling, That's the equivalent of sciatica, but sciatica in the neck. Definitely something you need to see a doctor for and get that evaluated. Maybe you don't have any neck pain, but your hands are tingling. And we already talked about carpal tunnel. We want to get that under control before it causes weakness and before it becomes a surgical condition. We all know prolonged periods of sitting, we just talked about it, and stress can cause headaches and especially migraines. Definitely something you want to get checked out and get looked at. Now, I want to warn you again about the over-the-counter medications. I call it a slippery slope because you say, well, I'll just, everyone that comes into my office, they're all more kind of conservative and naturally oriented to their health. Nobody wants to take pain medicine. But then the pain's there. What are you going to do? You still have to function, right? Life doesn't stop when your neck hurts, your back hurts. So you start with the Advil, and then you go on to the next one, and then you see your doctor, and you get something stronger. And then you get the next medication, and you start getting addictive medications. And it's a slippery slope that we go down. We all know about the opioid crisis. Estimates are 40 to 70,000 people a year are dying from overdoses to opioids, which is very sad. And a couple other sad facts. 80% of heroin users started opioids with a prescription from their medical doctor. Now, this is not a knock on your medical doctor. These are not recreational drug users. These are people that had an injury. These are people that had a problem. Maybe it started with prolonged sitting, and they had to have a surgery or a herniated disc, and they had to do something to control the pain. So they started on opioids and unfortunately became addicted. Now they're out in the streets looking for heroin. This second bullet point here is basically what gets me up in the morning. 59% of opioid users started opioids due to neck and back pain. I believe we can significantly reduce that number with proper care for the people's necks and back pain. This is the biggest driver of the opioid epidemic is neck and back pain. It's not recreational drug users, it's neck and back pain. And this last statistic is the scariest and the saddest of all of them. 32% of kids in orphanages today are there due to their parents' addiction. They're either in drug treatment programs or unfortunately have overdosed and have passed away. So most of you know I'm a chiropractic physician. What most of you may not know is that I'm also certified in sports medicine. I'm certified in the Cox technique. I'm certified in something called DME, durable medical equipment. So if some of you have had some of our neck braces or back braces, that's DME, durable medical equipment. And I've been doing this almost 30 years, which doesn't make me old, it makes me experienced. So there is some good news. Patients starting low back care with a chiropractic physician are 49% less likely to fill an opioid prescription. I think that number is much higher. Once we get patients in, we rarely have patients that have to continue on opioids. It does happen, but it's rare. And the British Medical Journal is telling us right here in this bottom bullet point about here's your answer to the opioid addiction with neck and back pain. Less likely for short or long-term use when starting care with a chiropractor. So we went over the 90-90 rule. We asked you to make up a workstation. We asked you to start following the 28-2 rule. We gave you some apps, we gave you some stretches. If those symptoms keep coming back or if they're getting severe, it's time to get it looked at. So if you've been in the office before and you're having either a new problem or you're having a problem that we need to address, or you're a current patient and you just keep forgetting to tell the doctor about that other problem I'm having, you can scan this QR code, answer a few questions. That way we won't forget about it. We'll know what it is, and we can see if it's something we can help you with. If you've never been here before, you can scan this QR code. And again, answer a couple quick questions. And what we're going to do too is we're going to offer telemedicine consult. So if you're not comfortable coming out of your house yet with COVID, if you want to limit your contact, no problem. We can do your consult telemedicine. We don't want you to come out or leave the safety of your house until we have a very good idea that we can help you or we can help improve the quality of your life. If that's the case, then we'll move forward. If it's not, then we won't. And when we do these consults, what I look for is problems that I can help. And if I know I can't help a problem, or if I know it's a medical problem, or it's an orthopedic problem, or it's a physical therapy problem, I'll send you to those providers. We're very blessed in this area. We have a lot of good medical doctors. We have a lot of good conservative orthopedics. And if we need to get their opinion, if we need to see a neurologist, we'll get you out to the appropriate provider when necessary. So a couple things I want to leave you with. When we're watching TV and we see these commercials come on for drugs, say it's a 60-second commercial for this new wonderful drug. 45 seconds of the commercial is these god-awful side effects that you're going to experience when you start taking this drug. And these are all negative side effects. Now, if you look at the drawing here, obviously the brain sits up here, spinal cord comes down the spine, and these nerves come out from the spinal cord. Not only do these nerves go to every muscle in your body, every joint in your body, but they also go to every organ in your body. So when we're working on people, it's very common for me to hear people say, hey, doc, you know what? I have more energy. I'm sleeping better. My sinus problems aren't as bad. My indigestion, my reflux, not as bad. I'm not taking as many puffs with my asthma. My breathing is better. People tell me their bowel habits and elimination, constipation is not as bad. Women say their premenstrual syndrome symptoms aren't as bad. So we get a lot of positive side effects with chiropractic care. So if you don't have a QR reader, no problem. We can do it the old-fashioned way. You can use the phone number. All that information we gave you, the apps, the YouTube channel link, what we did for you is we put it all on the Facebook page. So you can go to my Facebook page if you want a link to those apps. It's going to be right there for you. Also the link to our YouTube channel. You can get those stretches. You can start implementing those tonight. So I want to thank you guys, because I know after this year, the last thing anyone wants to do is spend another half hour on a Zoom call, right? And sitting in front of a computer. I'm sure that's the last thing you want to do. So I want to really thank you for your time tonight. If we can help you and be of service to you, please let us know. Be well and have a good evening.